Hi, my name is Mercy Chepkirui. I work at DAV International Wellness Center. I'm a clinical officer by profession, and I would like to bring to your attention about organophosphate poisoning. Have you heard about organophosphate poisoning? I'm here to be able to bring you on the know. Organophosphate poisoning are the chemicals that are used mostly by the agriculturalists. They are used to be able to, they are used as herbicides, pesticides, and pesticides. And these chemicals are mostly sold over the counter. You don't need a prescription to be able to get it. You just go and get it over the counter. 300,000 people die yearly because of organophosphate poisoning. A patient will come in telling you, I'm vomiting, I have a lot of diarrhea, I'm sweating. When you do an examination, you are able to check their pupils are pinpointed. They may be having a lot of bronchorrhea. They may be having a lot of bronchospasm. Others might even present with seizures. But with the pediatric population, you may not be able to get it well. But you can be able to get the history from the guardian. They can be able to tell you that they found, for example, a container containing those acaricides, and the children might be able to present with the smell. Most of the time, the patients might tell you that I ingested intentionally. Others will tell you that I ingested it accidentally. So once you've been able to get that proper history and you've done your examination very well, you can be able to do an evaluation. And based on the evaluation, now you are able to take an immediate action as an healthcare professional. As an healthcare professional, you are going to do both the supportive therapy, and also you are going to do the other, the therapeutic therapy. First of all, before you seek a medical intervention, there are some first aid that can be done at home. For example, if this organophosphate poisoning have been poured on your skin, you can be able to remove the clothes, and then you can pour water on your body, and then the next thing is rush this particular person to an healthcare facility where they are going to get help. We are living in a society that most people are suffering from mental illness, and most of them might not be able to be aware, and because of that, most of them die by suicide using organophosphate poisoning. Therefore, we need to be able to look at the safety measures to be able to prevent that. And September being the month of suicide prevention awareness month, therefore I'm here to bring to your attention. So some of the safety measures, number one is storage of these chemicals. So these chemicals are supposed to be kept out of the reach of children, and not just only children. We live in a society whereby you are living with a person who is having a mental illness, and sometimes because of that mental illness, for example, those who are having delusional disorders, like they have some beliefs about something, those who have perceptory disturbances, in the sense that they hear some voices, they hear some commands, so they can be able to reach out to those chemicals, and then they use it to attempt suicide. So it is very, very necessary for you to be able to keep out of the reach of children. And if you see somebody is mentally unstable, kindly be able to keep it out of their reach. Public health officers are supposed also to be able to create awareness using the community healthcare workers to be able to do sensitization of these chemicals, so that at least we can be able to save many lives. And then also, as a community, we need to be prepared for in case of any emergency that might emerge. Preparedness entails even being able to train people to do first aid in the community, sensitizing people about the mental illnesses, and be able also to teach our children to be able to know these products are dangerous and they are harmful to our bodies. So if you are also living with children who are having these conditions like attention deficit hyperactivity disorders, most of them tend to be very curious and they want to experiment with anything. So if you are living with such kind of children, and maybe those children who have intellectual disability or autism. So you should be able to be very, very much cautious and be very careful. These chemicals, keep them under lock and key. Thank you very much for joining me today. Remember, prevention is the best cure. And in case of any question, don't hesitate to reach us at Dove International Wellness Center. Stay safe and take care. Thank you.